Hello, everyone. I'm Gustavo Tolosa, and I'm sorry about the little introduction that I had planned for you. For some reason, technology, it's crazy. I have a big storm coming in the area, so I hope I can stay. Even though I have fiber optics here, I hope the internet stays throughout this transmission here. So today we are starting our first book club of 2021. And today is the first book club and the first session of it. And I'm so excited that the first book of the year is one of Dr. McDougall's book, which is Dr. McDougall's Medicine, Second Opinion. We have already read two of his books in this book club, The Starch Solution and The Healthiest Diet on the Planet. And so those sessions are in my YouTube channel. They're free. You're welcome to go see. They're all in the book club folder. You will be able to find it. So what is this book club? Well, we choose a book and then I assign you a few chapters a week for you to read. And then we focus on those chapters so that we can get the most out of the book rather than talking about 100 different things. And I sometimes have guests, and then other times I do cooking demos, and we have a support group where we can read a book and discuss and learn from each other. So that's the point of these book clubs. And today we have the star of all stars, which is Dr. McDougall, Dr. John McDougall, who has gracefully accepted to be here with me. How are you, Dr. McDougall?
Well, great. It's just my honor, Gustavo. I mean, you're a good friend of mine and also a compatriot, which we tried to change the world together with our webinars. And
right.
I think we made an impression. The world doesn't want to get changed very readily, but I think we did okay.
We did, and in the end, along the way, we had a lot of fun together, and but it's always so exciting to get to chat with you. So, Dr. McDougall, let's get one of the questions out of the way here, because I have had a few people ask me, why did I choose a book that was published in 1985 or 1986? So, of course, I know why. I know that all the facts that you provide in the book are still, they're still valid. So, but can you tell us a little bit about how this book is still valid today?
Sure. I've read through that book many, many times, not just the period of time when I wrote the book, which took me about 6 years to write. And when I wrote the book, I wanted to make sure that I wouldn't have to change things later on. And that's the way it's turned out. I haven't had to correct anything. The facts are the facts, and the truth, plain and simple, don't change. So if you get it right, if you get the truth, then you should expect that it's going to last forever. The world is still round. It's not flat. It's never going to be flat. I don't care how old it is. And so it is with the books that I've written. I did such hard work, and I was so demanding upon my understanding of the scientific literature that I wanted it to last forever, and it has. This book, I would correct a word in it. There's very little I'd add to it. Even approaches that we consider more like the new chemotherapy agents, I could probably cover that in a paragraph if I wanted to. But, when it comes to breast cancer, Gustavo, they're using the same 4 drugs today. And I strongly encourage you to go to the National Library of Medicine and see what has been updated. I bet you find many, many articles that support what I believe to be true 35 years ago. But I don't think you'll find any that contradict what I came to believe 35 years ago. So that's why I wrote this book somewhat out of frustration. I had done a lot of research for another book called The McDougall Plan. And that book became a New York Times national bestseller. I bet you don't have many New York Times best-selling authors on your show. I know it was a long time ago, but I was played as the best of Larry King, which is a real honor. So I was writing this book called The McDougall Plan, which was about the truth about diet. Back then everybody believed that you needed to eat meat and dairy and that eating starches made you fat. And I understand that that wasn't true. And I quickly learned that there's no such thing as protein deficiency. There's no such thing as calcium deficiency. And so I wanted to know a lot of things that other people believe to be different. And that gave me a lot of power, Gustavo. When it comes to the medical business or the scientific businesses, you gain status and power by what you know. You know, it's just like if you're in the banking business, you gain status by the amount of money you collect. And if you're in the real estate business, it's the number of parcels of land that you're able to gather. In medicine, it's the nuggets of knowledge. And so I started studying the importance of diet when it comes to patients' care. It's called diet therapy. It's a term that pretty much disappeared about 50 years ago, but it's called diet therapy. It used to be practiced a lot. And I came to understand what diet therapy was. Nobody else knew about it. Nobody knew anything about nutrition, including my most learned doctors and scientists that were around me. They had no idea. Not surprising, since the average medical student back then got 3 hours of education on nutrition. And 3% of the board exams had anything to do with nutrition. And I want to tell you, the knowledge that they learned was primarily learning biochemical formulas. It wasn't on how to take care of patients. It wasn't that you feed this kind of diet for somebody who has this kind of problem and they get well. Anyway, I started collecting these bits of information, and the consequence was, as I became the world expert. In the process of being an expert in terms of diet therapy, in terms of learning about protein and calcium and fats, etc., I also ran across a ton of information on how to take care of patients by changing their diet.
Right.
The importance of diet in terms of cancer. Well, you know, most people accept that today. But 50 years ago, you were considered a quack if you think food had anything to do with breast, colon, or prostate cancer. It's well established that food has everything to do with these diseases. When it comes to heart disease, I can remember, Gustavo, being in a lecture room called where there'd be 100 doctors in the room. And I remember one doctor suggested cirrhosis was reversible, the arteries would heal. And I heard throughout the audience a whisper of, this guy's a quack. You know, so things have changed a lot then, but I was always have been kind of a rebellious person. And so when I found out that my colleagues were treating people poorly and that there was a better way to treat people, I jumped on it. Now, when I say the thing I have to give credit to the medical businesses and the science businesses is we study our therapies to see whether they work or not. For example, when it comes to heart surgery, both bypass, angioplasty, essentially all the scientific research says that these two surgeries do not save lives. You know, we just had a few studies back then, enough for me to publish in McDougall's Medicine, A Challenging Second Opinion, that heart surgery doesn't save lives. But I could show you 20 studies. I can show you reviews that have been done on 12 different large studies. I could show you 15 years of data. I could show you where they treated arteries that were totally occluded. Every single time it shows that heart surgery doesn't save lives. And you and I know why. It's because they're operating on old, fibrous, stable, hard plaques. They're not operating on the part of the disease that kills, which is a rupture of a volatile plaque. So I know we discussed this many times in the past. Anyway, I found out all these things that my colleagues were based on economic rewards. It made the system make a ton more money, but it didn't help the patient. And my colleagues proved through scientific research that their own treatments didn't work. And that's part of McDougall's Medicine, The Challenging Second Opinion, to show you that what's being done to you today as it was in the past is fraud. It's just plain and simple dishonest. So, you know, that's what the science says about standard medical therapy and what it says about dietary therapy. In other words, changing from the rich Western diet to the kind of diet that I recommend will cure people of most of their diseases.
Dr. McDougall, how would you recommend that a patient, tactfully, because we know that a doctor could get his or her feelings hurt if you go with the book and say, would you read this book? But like you said in the foreword, who can object to someone who wants to know more and learn more? So how would you say that someone can say to a doctor, would you read this and tell me what you think about it?
Well, it's hard because today in your country as well as ours, we believe doctors should be revered. They're next to God.
Right.
And they put themselves up on that pedestal, and it's not good for them as well as it's not good for the patient. So how would I approach it? Well, whatever treatment was recommended to me, particularly if it was something serious that would cost a lot of money and had great risks, I would ask the doctor for scientific research that supported his or her recommendation. Start with that. I mean, after all, the recommender, the person who recommends therapy, ought to be responsible for proving it works. It shouldn't be you as a patient that proves it doesn't work. So start by asking the doctor to support their particular kind of treatment. And they're going to give you articles that favor what they do. Just, plan on it. They're going to be cherry-picked articles. But you could take these articles and you could get a big understanding from their point of view. Plus, any good article is going to give you other points of view. And it'll give you keywords that you can go to the National Library of Medicine and look up. I often go to the National Library of Medicine, and I'll put in a word like breast cancer or heart disease, and I'll put things like controversy along with it or adverse effects. And I'll get a tremendous amount of hits that direct me to people who don't agree with, the usual point of view. Anyway, I would start there. You're going to offend most doctors if you give them a copy of my book, unless you give them a couple of $100 bills along with it. You say, hey, doctor, look, I know your time is valuable, but this is important to me, so I'll give you $200. I don't know what they are in your money, but I'll give you $200 to read this chapter about heart disease. That's all you got to do. I bet you'd find a good share of my colleagues that are so eager to get money that they'll take the $200. But even if it's an attitude problem, Gustavo.
Right.
You're the customer. Excuse me. Where in any other business does the customer get scolded by the person who's trying to sell them something? What if you were going to go in and buy a new car? You walked on the showroom floor and you asked some questions about the car, and the car salesman got mad at you and told you were stupid and this isn't your place. And who are you? Are you a car salesman? How many years do you go to car salesman school?
Right.
Or is what your doctor says. So you're going to run into some very defensive people, but it shouldn't be that way.
It shouldn't.
You're the customer. You got to get that attitude in your mind. You got to start demanding the kind of care that any good customer would get.
Right. Dr. McDougall, one of the things that you say in the foreword is that caught my attention is that once a favorite mode of treatment is established, all other choices are usually unavailable for the patient's consideration. However, even though your personal physician may be disappointed with the treatments prescribed, rarely is there enough time or sometimes enough interest to question the knowledge that have been developed with many vested interests and passed on through years of medical tradition. So there really are, favorite treatments that are safe for the doctor so that he or she it's not as likely as that they will get sued, for example.
Well, that's one thing, but it also has to do with profit. Let's take, for example, screening for colon cancer. You have a choice, and this is based on the U.S. Preventative Services Task Force, as well as the Canadian Task Force, and I bet your government also has a task force that says that you can screen for colon cancer by checking your stool for blood. You can check for genetic material, which is called Cologuard. You can have a sigmoid exam done, or you can have a colonoscopy done. But guess what the gold standard is? The gold standard is a colonoscopy. It costs $40 to check the stool for blood. It costs $200 to get a sigmoid exam. It costs $3,000 to have a colonoscopy. That's the driving force, is how much money you make based on a procedure. Don't kid yourself. Doctors are people. They're driven by the same greed as everybody else.
Sure,
I know how to deal with the problem is don't have problems. Change your
Right.
diet and get well. Then you don't have to be going to the doctor all the time. Sick people go to doctors. Okay? So you don't want to be a customer. You want to get out of the business. One of my goals with people who attend our telehealth class, which I want to talk about a little bit, because what a great opportunity for people living all around the world is I don't know what I was going to do. I got kind of lost on track. Anyway, you want to get well so you don't have to be dealing with the medical business. Just like you don't want to deal with morticians. You don't want to have lawyers as your best friends. You just don't, because you're usually in big trouble. And anyway, you want to be healthy. You've read a couple of my favorite books on nutrition and how to get well. And you're reading a book now on the practice of medicine, McDougall's Medicine, a challenging second opinion. So you want to get well, you get out of the business. And one of the real opportunities for you since COVID-19, thanks for the virus, we've had to shut down our residential clinic in Santa Rosa, California, which you've been to. And instead, we do everything online. And I tell you, Gustavo, I'm not exaggerating a bit. I'm not trying to pump up our program, but every person who's been to both the residential and has attended the internet program, the telemedicine program, says that they're in favor of the internet program. They learned more, they did better. It was a much better experience. It's cost 1/3 as much to attend. And anyway, take advantage of it. Go to our website, and you're tired of being sick and overweight, and you want a doctor to help you get off your drugs, we'll do that. We'll help you get off your insulin, your diabetic pills, and your blood pressure pills. We'll do that for you. If you're a type 2 diabetic, not a type 1 diabetic.
All right. Yes. All of the information is on your website. And I think that the intensity and all the people learn and the hands-on is actually highlighted more in the online version than in the person. Of course, there are good things about both. Tasting the food was a major benefit, of course. But
that was good. And of course, we had expert chefs that prepared the food. Right. But you know what people say, Gustavo, is I had to go home after the resort experience.
Yes.
And I go home to my old kitchen. I didn't know what to do. I didn't know how to get started.
Right.
With the online course, we do it all in your own kitchen.
Right.
We have Tiffany, and we have a couple other people who are support specialists. And every morning,
yes,
they jingle you up, and they ask how you're doing and what your blood sugar is and your blood pressure, and you have any complaints, and what are you going to fix today? And they help you plan your meals. And by the time you get done with 12 days, you've cooked 3 times 12, 36 meals.
Right. And that's, most of us don't eat even that many different meals. So, but that's a wonderful way to get the practice of making your own meals. Dr. McDougall, I want to ask you this because you and I have done several webinars about cancer. You've done one with Chef AJ. You've talked about cancer so much. And the second chapter of your book is about cancer. So what would be, this is a personal question that I wanted to ask you. If someone, hopefully never will happen, someone close to you or even close to me has the news that they have cancer, what are the first 3 or 4 things that you would tell that person? I mean, would it be, first of all, on a McDougall diet?
Don't rush.
Don't rush.
People are in a panic. They think they've got
in a panic mode.
Immediately, right. These cancers, for them to manifest themselves, they've been growing on average 10 years.
Yes.
So you need to stop, put the brakes on things before you get treatments that you have to live with the results the rest of your life. And they weren't the right treatments if you had enough knowledge. So don't rush. That's the first thing I would tell you. As far as medical therapy, I would say anything recommended to you, like, for example, breast cancer surgery. I would say, give me the studies that show that amputating my breast would result in a better outcome than just taking the lump. Come on, show me the studies. Well, if you watch the presentation I gave on breast cancer, you'll know that time-honored classic study never to be repeated was done by Bernard Fisher in 1975 when he compared a large group of women or a lumpectomy without radiation or a lumpectomy with radiation. The survival benefits were the same at 7 years, at 10 years, and now at 25. Same survival benefit whether you have your entire breast cut off or just the tiny lump taken out. So the doctor would be dead in the water. Show me, you're the recommender. Show me that what you're recommending works. I assure you that they're going to be caught in their tracks because most of the time they're lying to you. When it comes to mastectomies, for example, it's a long story. Back when I started in medicine, say 50 years ago, essentially all women got mastectomies. In fact, some of them got radical mastectomies where they took the muscles and the lymph nodes. I mean, it really caused terrible, terrible disability in women. And since that time, there's been better understanding of how to treat breast cancer and what the results are. And again, Bernard Fisher did a lot when it came to this understanding. The pendulum swung so it's done. And now, Gustavo, they're swinging back to mastectomies. None of the science has changed, just the economics have changed. And of course, not just that you make more money, deal. And as a result, you're able to perform a bigger performance for the hospital nursing staff, and it's in the operating room. They call this a theater for a reason. So, taking out a little lump is something anybody could do. It's ain't no big deal, man. Just slicing off half a woman's body, that's a big deal. So you could be a real showman.
Dr. McDougall, what are some of the cancers that you would consider? I mean, they're all obviously all serious, but some that may not respond to diet therapy or that really need an aggressive treatment. Are there any that you would say?
The first thing you have to do is you have to get away from standard medical therapy. You have to realize that surgery, radiation, and chemotherapy do not result in a better survival. When it comes to women with breast cancer, there is a better survival from cutting out their estrogens in their body, reducing estrogen, but not these toxic poisons that are given. I mean, the benefit is in the tiny percentile. Premenopausal women, it's fewer than 11% survival advantage at the end of 25 years.
Right.
Yeah. But for postmenopausal women, it's only a 2% advantage to taking cancer chemotherapy. To get sick, to spend that kind of money, to lose your hair for a tiny to a non-existent advantage, one you could easily get by taking tamoxifen or having your ovaries cut out. Boy, oh boy, do you have a lot to learn. And, that lecture that I gave on breast cancer, which is the lecture I would give to you if you were my patient, is on YouTube. Just look up McDougall and breast cancer, or McDougall AJ and breast cancer, Chef AJ.
Yes.
It's a great one. I put a lot of work into that. I went back for 40 years of hard work, right, about breast cancer, what they need to know before they decide on various treatments.
And so are all those questions that you included in chapter 2 about cancer? It's like question, answer, question, answer, question, answer. Those are questions that you've heard hundreds, if not thousands of times.
Yeah. Those are the questions that women ask me, because I was a practicing doctor when I wrote that book.
Right.
And these were the things that women had asked me about breast cancer. And, I wrote it in that format because there was an awful lot of information. And to just take and write it as sentence after sentence, paragraph after paragraph, whoa, that'd be just too much for any reader. So what I did is I told it as a story of a patient, getting back to that same idea of a patient who has these particular problems and how I would answer them.
Mm-hmm.
Now we've got it on a Zoom broadcast.
Right. So you mentioned that first thing, don't rush into anything. Did you say, what else would you say to someone that is just heard the news?
Well, when the doctor says you have to have such and such done, you say no. You say, wait a minute, I need to study this a little bit. I need to talk to other people. I need to get some second opinions. So again, that falls under the category of don't rush, but more specifically, don't accept the first thing that's recommended to you. It happens to be based largely on the bias of the doctor who's the recommender. You know, if you have, say, breast cancer, you go see a radiotherapist, what do you think they're going to recommend? You go see a surgeon, what do you think they're going to recommend? You go see an oncologist, what do you think they're going to recommend? Their business is chemotherapy.
Right.
And you know, it's interesting, Gustavo, I've had many experiences where women have told me they've gone and seen these three types of specialists, and they would tell me, you know, the surgeon and the radiotherapist, they had really bad things to say about the oncologist. And the oncologist and the radiotherapist, they said really bad things to say about the surgeon. See, they talk about each other behind your backs. Maybe that's part of getting more business. Maybe it's the fact that they know the truth, but they won't face the facts and the truth when it comes to their own bread and butter. Right.
Yes. Dr. McDougall, could you clarify this question that someone has? Someone is saying, so no matter what the type of cancer or the stage, does Dr. McDougall not recommend chemo? Did I understand that correctly?
No, yeah, you didn't understand it correctly. For solid tumors, when it comes to leukemias and lymphomas, that's a little different. When it comes to childhood cancers, that's a little different. But what we're talking about is solid tumors like colon, breast, prostate, pancreatic, lung. Those tumors. The benefits in terms of overall survival are tiny to non-existent. To actually worsen survival. And so it's not hard to find out this too, Gustavo. We have the tool of the internet. You can go to Google. You can go to the National Library of Medicine. You can look this stuff up for yourself. At least half of the articles are given away for free. And, you know, there's enough information in the free articles for you to become a world expert on your particular problem. And by the way, it's your problem. You ought to become an expert at it. It's not the doctors. Whoa. You know, right. You have an obligation to yourself or your spouse or your child or your parent to become an expert in this so that you can defend them, so that you get the right care. Exactly. And too often when it comes to cancer is minimal therapy is best. Like when it comes to breast cancer, all I do is I have the lump removed in a woman's chest. That's it. No mastectomy, no lymph node dissection, no radiation, you know, no chemotherapy. I do put them on a little bit of anti-estrogen treatment, which would be tamoxifen, aromatase inhibitors, and or removal of the ovaries, because estrogen promotes cancer, breast cancer. So it is important to at least think about lowering your estrogen levels. It's not the most important thing. The most important thing is to change what you eat.
Right.
And you know, this has been I wrote the book McDougall's Medicine: A Challenging Second Opinion in 1985, I believe. The year prior to that, I wrote the first study on the dietary treatment of breast cancer. It was published in 1984 in the journal Breast. If you read that article, and it's present on my website, if you read that article and then you read what has happened since, you'll find that it took the American Cancer Society 35 years to come to the same understanding that I came to back before 1985. In February, actually it was February 13th, 2015, the American Cancer Society came out and told doctors that part of the fundamental therapy that they offer their patients needs to be a high plant food-based low animal food based, low fat diet, the kind that I've been recommending for almost 40 years. It took them that long to figure it out. But, at least they did. Something else for my colleagues to ignore.
If doctors were compensated differently, and you talk about how Medicare, I think Medicaid, I can't remember which one you mentioned, that they were trying to pay the doctor not for like specific procedures, but for prevention. Do you know what I'm talking about?
I do. There was a special kind of care called capitated. And what that meant was the doctor was given a certain amount of money to take care of a certain volume of patients. And all the money the doctor saved from taking care of the patients, the doctor got to keep. So, the doctors did things like gave the patients cheaper drugs and shortened their hospitalizations and, maybe in some cases took less radical surgical treatments. And, that's the way that they tried to cut costs so they could keep the money under a capitated system. The way to really keep the money is to make your patients well. Can you imagine what would happen if you had no sick patients and the government gave you a whole bucket of money? And what would you do with the money? You'd have to spend yourself.
Dr. McDougall, that way, though, that system, I don't think did it really take off or not?
No, it didn't. It got squelched by the insurance companies. See, the insurance companies like a fee for service, and so do doctors. I figured this out back when I first started in medicine. I went to St. Helena Hospital, which was the second best heart surgery hospital in California. And we had a competitive way to take care of heart patients, and that was to change their diet, which gave better results. And I started talking to the insurance companies back then, and I would suggest to them that we could accomplish even more in terms of the patient's better health by prescribing the diet, putting them through the program that I ran for $5,000. And heart surgery was costing $100,000. So I said, figure. I said, we can get better results for $5,000. And they said, well, Dr. McDougall, he says, with what you recommend, the patient has to cooperate. What the surgeon recommends, all he does is make them unconscious, slap them down on the operating table, and that way takes care of the chest pain. I said, yeah, but some people would be really interested in not having surgery instead of changing their diet. Don't you think we could at least offer this option to these patients? And then they fixed me with the right answer. They said to me, you don't get it, McDougall. He said, the way it works is this. We take a piece of the pie, and the bigger the pie, the bigger the piece. That's the problem, Gustavo. It's all money. It's not a conspiracy. It's not these are bad people. They're just people.
Right. But we are emotional beings, and sometimes we don't think, cold, and we attach this feeling, I guess, to the doctors being there, taking care of our health, not caring so much about money because this is what they love to do. And I think that image maybe at one point was true, but it's not quite true anymore.
The problem is doctors don't love what they do. And the reason they don't love what they do is because they get terrible results.
Right.
The greatest joy in life is helping other people.
Exactly.
What if you did heart surgery and you found out heart surgery doesn't save lives, and the patient found it out? You'd feel pretty bad about things. So, doctors are unhappy, right? They're unhappy with the payment system and the lawsuits, but the basis of their unhappiness comes from the fact that their therapies don't help people. Now, that's a general statement. There are specialties like orthopedic surgery, where the doctor comes in and straightens the bones and does a wonderful job for the patient, changes their life. Right. Tremendous reward for that doctor, or eye doctors who replace cataracts with little pieces of plastic glass. Amazing. You give the sight back to an individual and they feel real good about their business. But when it comes to general doctors, or worse yet, cardiologists and oncologists. We're not helping people except for rare exceptions. So they feel bad because they're not getting the most important reward. It'd be like if you were a florist and you delivered flowers to everybody's home and the flowers arrived all wilted. Would you feel good about that? Or you were a bridge builder and half the bridges you built fell down?
Yeah.
You don't. That's why doctors are unhappy, Gustavo.
Right.
If they could have the joy that I have in my practice, they would love to get up and go to work every day because, patients don't get a bag full of pills and a bunch of excuses. They get a cure. And they appreciate being cured, and they get off their drugs, and they avoid surgery, and they feel good, and they lose excess weight, and they have a good bowel movement. And man, oh man, they're happy. Happy patients make the doctor happy.
Right. But what I think it's also very difficult for a doctor to do is, like I don't know, in the old, the 40s, 50s, when doctors would smoke. It was difficult for many of them to say to a patient, don't smoke. Now, doctors that eat a standard American diet, how can they say to their patient? I mean, I see some doctors here that are obese and they have greasy, skin, and they eat amounts of meat and dairy, incredible. How can they say to the patient, eat a plant-based diet?
They can't.
They can't.
They can't see beyond their own dinner plate. That's the problem. So it's like the smoker analogy you gave. You can't get a cigarette smoker to tell you this is a bad habit.
Exactly. So the patient would many times has to spend the time, and I know many people don't have the time and the resources to find a doctor that would be aligned with.
But they're so rare.
So rare.
It's, the reason is it's difficult to make a living the way I do. I figured out some ways to make a good living, but it took some exceptional work and some good luck. But when you have to take and spend an hour talking to a patient, as opposed to 7 minutes that it takes to write a prescription, and you get paid the same amount per visit, whether it's an hour or 7 minutes you spend, it's pretty hard to figure out how to make a living doing what I do.
Dr. McDougall, someone asking this, a lady here, Susan, asked, do you believe that mammograms are done too often?
Yes, they're done way, way too often. In fact, the Cochrane collaboration in the year 2012, Cochrane collaboration is the most respected body of scientists and medical doctors in the world. There are 50,000 scientists and medical doctors which evaluate various kinds of treatment. And the Cochrane collaboration came out in 2012 and told women to stop getting mammograms. They sent a brochure in 13 different languages telling women to stop getting mammograms. So, I think mammograms are foolish. They're crude. They cause more harm than good, and that should be stopped. But they're, a $10 billion a year business just in the United States. And that's just the test. That doesn't include the various treatments that follow, which is another many billions of dollars.
Exactly. What about things like skin cancer? Someone says here, my mother and sister both have skin cancer from years in the sun, unprotected, and I fear that I'm next. Can this way of eating help me avoid their fate?
It actually does. There's a study published in the New England Journal of Medicine on people who had precancerous lesions called actinic keratoses and squamous cell and basal cell carcinomas, which are due to sun exposure. And they showed that the recurrence rate was about 1/2 to 1/6 as great in those people who followed a low-fat diet. So, a good diet does help. But the first thing you need to understand is most skin cancers are not lethal. Your squamous and basal cell cancers rarely threaten your life. And actinic keratoses, which is a precancerous lesion, never threatens lives. It's melanoma that threatens people's lives. It's a whole different class of skin cancers, whole different cause. those kinds of cancers, it would be nice if you could find them early, but it's questionable whether you can find them early enough. So that's one thing, is you do want to avoid getting skin cancer of any kind. It's ugly, it's hard to take care of. But if you do get skin cancer, there's some simple ways to treat it, which are almost never offered. There's a class of drugs called Eldera. Eldera is the drug. Eldera is a skin cream which you buy for really cheap, $18 for 12 packages of this cream that you use. It's FDA approved.
Wow.
FDA approved for treating basal cell, squamous cell, and actinic keratoses. There is another kind of drug that is out for treating skin cancers, and I can't put my finger on the name right now. But there's also a over-the-counter arthritis medicine called Voltaren. And that is an FDA-approved way of treating skin cancers too, particularly actinic keratoses. So you go to the store and you buy this ointment called Voltaren, which is not prescription in the United States. And you put that on, that helps with these skin cancers too. So there are lots of ways, and you ought to look into these other ways, because the alternative is to get liquid nitrogen on the lesion, or to end up having bits of your face cut away,
right?
Which leaves you with scars and deformities. So, why not take the simple route? Doesn't cost hardly anything.
Right.
It's under your control, and the results are far greater. The benefits are there. And this is what I just talked to you about in terms of skin cancers and standard medical therapy. It's not anything some health food doctor on the west coast of America discovered.
Yeah, yes, exactly. What was the name of the organization that you mentioned, Dr. McDougall, when you were talking about?
It was the Cochrane collaboration, Cochrane, Cochrane.
Cochrane, yes.
Yeah,
okay.
It's based on the work of Arnie Cochrane, who is now dead. But Arnie Cochrane, he questioned the kind of information that physicians were getting and patients were getting. And so he set up this review system, and they produce Cochrane reviews, where they'll take, say, treatment of head lice. And they'll look at the various ways to treat head lice, and they'll come out with a conclusion formed by an expert in that particular field. Or they'll take at the other end of the spectrum, cancer chemotherapy or breast cancer, and they'll give you an opinion. And they're pretty good opinions. They're fairly unbiased. Not totally. I don't agree with all of them.
Right.
They're pretty unbiased. They're worth looking at. It's Cochrane.
Right.
Okay. That's one of the terms I use when I go search the scientific literature. I want to know what Cochrane says.
Yes. I've seen you talk about that a lot. Do you mention anywhere in there pancreatic cysts, or can you say a word or two about that?
Pancreatic cysts are benign. They're not cancer. But I did write about pancreatic cancer. It's in my November 2011 newsletter. And it's titled, "Why Did Steve Jobs Die?"
Yes.
And it's a thorough discussion of why Steve Jobs died and why he was terribly mistreated. One of the smartest men that ever walked this earth, certainly one of the richest men that ever walked this earth. The inventor of Apple and Pixar and all kinds of important accomplishments. This man died at 56 years old of pancreatic cancer, and on the way out, he was treated viciously. Liver transplant, horrible surgeries, chemotherapies. Steve Jobs was actually a vegan vegetarian most of his life, and his doctors made him go off a vegetarian diet. He was a vegetarian for ethical reasons, for animal welfare, for saving the planet. And so they eventually made him violate some of his most important principles.
Yes.
And got him eating animal foods, which is, I'm sure, hurt him as much as anything. If you'll enjoy that article, you can just go to my website. You look up Steve Jobs in the question mark, and if you can't find it there, you find it in my 2011 newsletter.
Okay.
Pancreatic cancer, which seems like a lot of people are getting these days.
Yes. Well, I will be certain to include that link when this replay goes out.
All right.
Thank you again, Dr. McDougall.
Good.
You're always welcome to just come in and talk to us.
Well, thank you, Gustavo. And I just hope your following understands what an important person you've been in my life.
Oh, that's very kind of you. I couldn't.
We worked together for many, many years, and you just did such a phenomenal job. So
Well,
any
thank
small
you.
thing that I can do in return is something I would be happy to do.
Thank
Good luck.
you. My pleasure.
All right.
My honor. Okay. Goodbye, everyone. See you next Monday. Thank you, Dr. McDougall. Bye-bye.
Thanks a lot. Bye-bye.